Hi, everyone. Welcome to our discussion about the University of Louisville Endocrinology Fellowship Program. My name is Dr. Rebecca June. I'm one of the junior faculty, and I joined the group in October of 2023. I've had a great experience meeting everyone and enjoyed working with the current and past fellows. So this will be kind of a conversation touching on several different topics of what the fellows here have experienced and how that has, helped them in terms of their clinical and career development. As an outsider, since I trained in a different program, it's been great getting to know, how a different program has worked. So we'll just go through a couple questions, but first, let me go ahead and have everyone introduce themselves. So I'll start with you, Rahul.
Hi. My name is Rahul Pansare. I graduated in 2023. I did my residency training in Michigan and then did my endocrinology fellowship at University of Louisville. Yep.
Okay, and what about you, Danny?
Hi, Danya. I was in the same class as Rahul, graduated in 2023, did residency at Providence in Michigan, and currently I'm working as clinical faculty at the University of Michigan.
Thank you. And Rohit?
Hi, I'm Rohit Kulkarni. I just recently graduated in June of 2024, and I did my residency here in New Jersey itself, and I've started work also in New Jersey.
Great. And Nander?
Hi, I'm Nanda Mott. I am also recent graduate as Rohit this year, and I did my residency in Texas State University in Amarillo, and then I have my fellowship training in University of UofL, and now I am moving to Ohio to start working as an attending.
Okay, great. Well, thank you all for being here. So just wanted to start with maybe Rahul, and if you could comment on the teaching that you received from the faculty and your senior fellows at this program.
I think the teaching was awesome. The faculty is extremely approachable. Dr. Krish, Dr. Mok, Dr. Raval and Dr. Subai. Great curbside learning. I think the training program is very structured in terms of having journal clubs and meetings, 4 p.m. meetings, a lot of educational activities. So it's learning on an ongoing basis through direct patient care, as well as through getting to learn the academics and the literature review. So yep, definitely.
Great. And then, Danny, I wanted to see if you could comment a little bit about working with our mid-level providers. Particularly, we have Liz, who works with our team on the inpatient setting.
So at the University of Louisville, we have very good mid-level providers that we work directly with. Liz is very good at her job, and she's a team player, and she's very good to work with. There are times when we are inundated with patients and consults, and Liz would actually be very supportive at that time, especially when you start. I remember asking Liz for advice, and she's very approachable, and she's really good. Should I comment on the other mid-level providers?
Yeah, go ahead. Yeah.
And especially regarding diabetic education, we work with Emily as well, and then we work with our diabetic pump mid-level providers who are very good at the VA.
Yeah, and I would say, from my perspective as faculty in the clinic, we have a really excellent support staff from diabetic education and nutrition on multiple levels. So that's been great. So, okay, great. And then kind of on the topic of, interpersonal or communication with different team members, I was hoping, Nender, if you can comment on our relationships perhaps with other specialty services, like the surgical subspecialties.
Yes, so we have a very good correlation and collaboration work with the pituitary team, the neurosurgical team, and we also have the monthly pituitary conference, which is really good. We submitted the interesting cases, case discussion with multidisciplinary team from pathology, radiology, case discussion, which is very good. Even in the clinic setting, then if you want to discuss a case with them, then they are very welcome to discuss the case with them. That is with the neurosurgical team. With the endocrine team, the surgical oncology team, they are also very approachable. And we do have the JUMA board now that was started last year, which is really helpful to me, very good educational experience for all of us to learn from different interesting clinical cases from community levels and also from our university itself. And then they are also really approachable, and then also really nice to work with them.
Yeah, I totally agree. I think, not to kind of tease surgeons, but sometimes, there's some very strong personalities, but everyone's really approachable here. And they've really added to our educational experience at the multidisciplinary conferences. And we've, learned a lot from, like you said, neurosurgery, ENT, interventional radiology, radiation oncology.
Yes.
Okay, great. So moving on a slightly different topic in terms of the clinical rotations, I wonder, I was hoping maybe Rohit, if you could kind of go through kind of how the structure of first and second year work in terms of your rotations.
Yeah, when it comes to rotations, we basically have four major rotations. One is at the VA, the other one is inpatient service, which is at Jewish Hospital, as well as Fraser Rehab, and as well as the University Hospital. The third rotation is our research one or clinical block. We're mainly going for clinics since endocrinology is an outpatient dominant field. And the last thing, the fourth one is research two or completely research block, where you get a lot of time to do whatever research you're doing, maybe posters, maybe actual research. Danny, my senior, she did the hypoglycemia protocol. I followed on that. Nandar as well as Rahul, they did in terms of cystic fibrosis research on bone disease. So that block is heavily weighted on research. So you can do whatever research you like to do. And out of the 2 years, so you have around 24 months of total blocks. It's equally split. So you have 6 months of each block. So 6 months of inpatient service, 6 months of VA, which is inpatient as well as outpatient, 6 months of research one or clinical block, and finally research block for 6 months in the entire course of 2 years.
Okay, great. Thanks for the review. Since I wasn't fellow, so I also learned some things there. So, okay, so Rahul, I was wondering if you could comment a little bit on maybe some of the specialty clinics you had a chance to attend, perhaps like CF clinic, things along those lines.
For sure. So, yes, definitely there were plenty of specialty clinics. Starting from the VA, we had a pump clinic. This was on 2 Fridays, in the month. So all that we did in the morning was just see pump patients. It was excellent exposure because we were managing and troubleshooting all the issues and the problems that they had with the pumps. There was a pump rep that was on site, and any issues that we had, we could run it by her. So definitely a great educational experience there. The second clinic was the bariatric clinic. Again, we did that on afternoons once a month at the VA. That was something very interesting because we dealt with everything related to bariatric, post-bariatric complications, from hypogonadism to hypoglycemia, management of weight post-bariatric surgery. So all of that was interesting. The third interesting clinic was, like you mentioned, cystic fibrosis. That was again Mondays, one Monday in a month. People, it was very humbling and to see people coming from 3 hours away, 2 hours away by car. They would travel to the clinic just to see Dr. Krish. Great exposure again to that population, because that population is so unique. in terms of managing their diabetes, again hypogonadism, fertility issues. That population actually has issues with losing too much weight, and you have to focus on how we can try get them to gain some weight. So that's completely opposite from what we usually deal with. Then we had the collaborative clinic with neurosurgery that used to happen with Dr. Krish on one of the Tuesdays. That was very interesting because we got to see some of the radiology images, discuss it with neurosurgery, discuss with the plan right there in the clinic with them. So that was rewarding. Which other? Am I missing out on any other?
Reproductive endo.
Reproductive, yes. Oh, yes. And reproductive, and even the was it laboratory rotation? So the reproductive was interesting. It was a 2-week rotation with Dr. Hunter. That was quite something entirely different because the reproductive endocrinology is challenging in its own ways. So that was nice to kind of at least know when to refer to them and how to deal with those situations or answer some common questions. And then the other one was the laboratory rotation, where we looked at lab values and assays and why certain, things happen. Like, for example, the hook effect with prolactin, nomas, and things like that. So that was kind of interesting to know the backstory of what we learned. Yeah.
Okay, great. And then I did want to ask, maybe anyone can chime in, experiences worth working with Dr. Folsom.
Yeah.
Oh, Dr. Folsom is so good to work with. One of the best things about working with her is you actually learn how to streamline your clinic. And it's not just the education part that is really good. It's also the practicing part of actually running the clinic, handling patients, talking with them. So I do really enjoy. Did really enjoy the time I spent with her.
Yes, for sure. And the good part was she offers you to either see patients on your own or kind of observe. And both of the things have their own positives. With her, like Dania said, the way she used to run the clinic, it's nice to see that, because for me, I think outpatient have adapted a lot of the way she used to do that, of giving out handouts and writing, making sure that the patient visit summaries are filled out and whatnot. So that was definitely a rewarding clinic.
Yeah, and a little bit of addition about Dr. Folsom clinics has a great experience with the transgender population, because she loved to see the transgender population. So have a very great experience learning from her how to approach the patient communication part with the transgender population. All of those, and clinic efficiency, all of those is a great learning experience with her.
Mm-hmm. And
Yeah.
just kind of for more background, she is med peds, right? So she works particularly also with transitions of care from the pediatric endocrinology side to adult side. So I'm sure that you guys have seen a lot of great cases, navigating that transition that can be very difficult for some patients with, like, for example, type 1 diabetes transitioning to adult care and things along those lines. So that's great. Okay. Great. So changing topics a little bit, I was wondering if maybe, Nander, if you don't mind talking a little bit about board exam preparation through our program.
Yes, so we do have a board prep with one of our faculty, Dr. Sibai, did the board prep session twice a month. Previously, it's like every weeks, and later, because of the Juma board, every two times a month. So it was changed to twice a month. But it was a pretty good board prep sessions, discussion, and then answering the questions, and then also the references part, and then we can go through that part as well. So which is really helpful for the board preparation. And also with the clinical experience, and Dr. Krish also kind of sharing some of the journal articles that are related to the board preparation and all of those that are all helpful to our exam.
Okay, great. And then one other, changing tactics again a little bit, and kind of opening this up to the group. I was with if you have any comments on kind of connections made with like our community colleagues, or kind of help with the job search, and connections that you obtained through the program, I'll kind of open the floor to the group.
So when it came to
sorry, go ahead.
job search, it was very helpful for me. I had Rahul because Rahul was in the same boat as me. We both came on J1 visa, so we both had to obtain a J1 waiver. So that's slightly more difficult when it comes to getting a job and applying. You have to apply way in advance. So Rahul, I didn't know anything before this about what are the different types of waivers, but he did help me out. Same with Dr. Tanwani. He's also done his waiver job long time ago. So he also gave inputs when it came to getting a waiver job, because you need to start searching maybe 1 year before. So in your first year itself, you need to start searching for waiver jobs. And then the process, of course, gets delayed. Like I'm still not working, but it takes time because just for getting the visa. So we need to plan ahead. So we do have contacts, and they can always help. Like we can always reach out to the people who come on J1 visa and help them out.
Yeah. So for me, I think what was nice was the Endo Club meetings. I think that was outside of the program, but we would meet a lot of the community endocrinologists like Dr. Luhano and all of the other doctors. So it was kind of nice to get to know the small endocrinology Kentucky community there. Even I think we met Dr. Pillow in one of the meetings, who's our endocrine surgeon there. So that was nice. And for me, again, like Rohit said, Dr. Tanwani and they are gratis faculty here. So Dr. Tanwani, Dr. Dio, it was kind of nice to kind of talk to them since they have been through a similar J1 waiver process. I got my job because of the program, because I had one of the internal medicine residents rotating with us. And I happened to talk to him, and he said, "Oh, you should apply to this job, which is like 2 hours west of in Evansville." I'd never even heard of this name of the city. And he was like, "You should go and interview there." And I was like, "Oh, okay, I'll try." And then it worked out somehow. And I got the job because of that. So yeah.
And yes, and also you also get a lot of the recruitment invitation email from the program. Kelly also forwarded this email, a lot, and then Dr. Krish as well. So we do really have a job, search opportunity from the program. Yeah.
Okay, well, great. So I think with our last few minutes, I just wanted to, I'll kind of go around to each of you for kind of closing comments and, just anything else you wanted to say about the program. So I'll start with, let's go, I guess we'll go in reverse order. Maybe we'll go with Nander. If you want to go ahead.
Okay. Yeah. So it was really a great and enjoyable learning experience, and then very wonderful to work with the UofL endocrinology family and all the supportive learning environment, and academically, clinically, even in the job search, they are supporting all the way along the training up to the you find a job after finishing the training. So I feel very lucky to join the UofL endocrinology program as well.
Thanks. And Rohit?
Yeah, I would agree with that. Right from day one, like when we joined the program, everyone was friendly. We had time for preparation for our internal medicine boards as well. Education has been phenomenal all throughout. You get exposed to all type of pathologies. In final year, you get again exposed, as we said, with Dr. Folsom and all, Dr. Deo, Dr. Tanwani. The entire crew is very professional, and they help you out even how to when it comes to transition to actual professional work. So that was something very good. And overall, it has been amazing. I'm even going to join the grand rounds. So they've already sent us links which we can join anytime on the Thursday. just join the grand round, so you can always be exposed in terms of education.
Great. And Danny?
So, as far as I'm concerned, I would not, if I could go back in time and do something else, I would not. I would make the same choice and come here. Not only is the faculty very, very invested in your future, as far as education is concerned, they're also very invested in their trainees' emotional health. We really, I know they say it's a cliche, you're like a family, but you really do feel like a family here. The faculty is extremely approachable. The depth of pathology that you see here is remarkable. The education is very good. Louisville is a great place to live. The food there is awesome. There's a lot to do there. I would not have it any other way.
Oh, awesome. All right. And we'll end with
And
you.
I've made lifelong friends also.
Oh, that's sweet. Yeah, go ahead, Rahul.
Yeah, I kind of agree with all of them. I think it'll be a little redundant, but quickly summarizing that, very friendly faculty, approachable, a great work environment. Because I think, if the work environment is toxic, then it becomes difficult. But here it was a joy, right? I think excellent pathology. The inpatient census is heavy, but then you get exposure to the whole width and breadth of endocrinology, whatever it has to offer. And then I think the teaching program, and I haven't trained anywhere else, but I've heard a lot of my colleagues, former graduates from other places who say that, and I've heard how their system works. And I feel like here the fact that the rotations are so clearly divided into 4 categories, and then you rotate, through each of them, it's very, very systematically, divided so that you get exposure in all of the various areas in endocrinology. And then the other part was the approach to each clinical scenario and each clinical case, the systematic approach that they teach us. I think even now in my daily practice, I can use that. And I remember Dr. Chris saying what Dr. Chris said, and what Dr. Mook said, or how they approached their cases, or Dr. Savai, how he approached his cases. So I think all of that has really, really, really helped, not only from board preparation and exam point of view, but also from a day-to-day practice. So like Dania said, I don't think I would have it any other way. The friendships that we have formed are like lifelong. So yes, for sure.
Awesome. And yeah, I'll just kind of chime in at the end. Coming from other programs, I trained at Baylor, and I was at IU, Indiana University, before coming here. And I think I was pleasantly surprised, by the breadth of pathology here, and the quality of teaching, even for a smaller program comparatively speaking. But I think that's nice in the sense that it is more like a family feel, like you guys had mentioned. So. Well, I really appreciate everyone's time tonight, and your comments on the program. And I think we'll wrap up here. So thank you, everybody. I'll see you guys later.